You happen to be walking through the nursery and you notice a kid is cyanotic. What would you look for? They say, oh, this is not some benign something, and maybe someone of your expertise would get involved. What would be the thing you'd be looking for, or history, that this is more than anything? Without doing any tests, not checking oxygenation, just looking at the kid, what would you say? It's a common concern.
Okay, I think history is very important. Generally speaking, as a physician and cardiologist, one needs to look at the various causes of cyanosis. There's two major types of cyanosis, what we call central cyanosis, which means that if you were to measure the baby's oxygen, it would be abnormal, or what we call peripheral cyanosis. So the first thing you look for, and you see this a lot after a baby's born, when they take the baby from the nursery into the nursery from the delivery room, the baby may be cold. And that's why we put newborn babies in warmers. If you look at a baby just as they enter the nursery, before they go in the warmer, they'll look blue. The fingernails, lips may be what we call dusky or cyanotic. However, if you were to measure that oxygen level, it would be normal, because that's basically caused by constriction of blood when someone's cold. For example, you'll see children in a swimming pool, and you'll see 3 children swimming, and one child, the lips are turning blue, and everybody panics. That's not because that individual lacks oxygen, it's just that that is the way they respond to cold. So the first thing to think about when you see a baby lying there looking comfortable is maybe the baby is just cold. Let's go to the other type of cyanosis, the more serious type of cyanosis, and that is what we call central cyanosis. Cyanosis is actually caused by a problem that results in poor oxygenation in the blood. You look for a cause, and there are multiple causes. The most common causes are...
If the kid's resting, warm, and is blue, is that a red flag?
Of course it is.
If the kid is crying and cold and is blue, is that a red flag?
May or may not be. It all depends on whether or not the baby can be cold, but also have a problem related to the heart or lungs.
Baby's warmed up, that particular one.
It goes away.
And not blue.
It goes away. And generally speaking, I would say, again, one is going to put an oximeter or check the oxygen level.
So in other words, if you get a measurement that the saturation is 98%, you're not too worried.
That's correct. Now, what one has to realize, all right, so let's take a scenario. Let's, for a minute, not look at the baby that has a real problem, but look at that healthy, full-term normal baby. Baby's born, baby's a little cold, you warm the baby up, the baby's fine. 24 hours later, someone notices that with feeding, the baby gets dusky. Just with feeding. Now, what would one do? Well, again, you need a little bit of help here. All right, could this be something serious? Yes. Is it possible it's normal? Probably yes. So how do you approach the baby that with feeding gets a little dusky or blue, but the rest of the time is fine? Even when the baby cries, nobody really notices the cyanosis. So, these are the kinds of things. Number one, a good physical examination is important. And what you would try to do is document this baby's oxygen level with a simple oximetry while the baby is feeding. So you put an oximeter on the baby's 98, 99% all the time. With sucking or breastfeeding, it drops into even the 70s. What is that? Now, in general, they will call the cardiologist because people will be concerned, does this baby have heart disease? Thing about congenital heart disease, it is uncommon that you will have a 98% or normal saturation, and then all of a sudden have a 70% saturation. Not saying it can't happen, but it's a common. Babies who are born blue with cyanotic disease are generally blue all the time. Their saturations may vary, but they're abnormally low. But there is a phenomenon you see in healthy, normal babies, and that is called shunting across a hole that every baby has at birth, called a foramen ovale. This is a hole that has to be there in utero. When the baby is born, most of the time this hole will not close right away. In fact, 10-15% of normal individuals may have this throughout life. What happens is when a baby is sucking and straining when they're sucking, they increase the pressure on the right side of the heart, what we would commonly call a valsalva. They're straining, they're pushing up that pressure, and a little bit of blue blood during feeding may cross that foramen ovale and go to the left side of the heart and cause the baby to be desaturated. It's a particular phenomenon that you see with feeding full-term babies. If you study them, you do echocardiography, you listen to them, they're absolutely normal. And what happens over time with reassurance, it goes away. So that is a common phenomenon, a cause of cyanosis or balloonis that you will see, which is not a result of anything serious.
Thank you.